Dr. Laura Savage. I'm a consultant medical dermatologist and senior lecturer from the University of Leeds in the United Kingdom. I'm also on the board of the British Society of Medical Dermatology, and I'm the current Vice President of the Group for Research and Assessment in Psoriasis and Psoriatic Arthritis, also known as GRAPPA. Here at EADV 2025, we had a symposia for GRAPPA adjacent to the EADV, as we do every year, and it's great to see that year on year we're seeing more and more dermatologists engaging with GRAPPA. We've always been very rheumatology heavy, so we really are encouraging more worldwide colleagues to join us, and we invite those of you in China, of course, to come and join us in GRAPPA. For those of you who are not aware about GRAPPA, it's an international organisation for clinicians, but we also have patient research partners, and we've got a very active young GRAPPA section as well. So trainees through to the most senior consultants are absolutely welcome to come and join us. We had a really diverse programme here at the EADV this year. So myself, I was speaking about the challenges and opportunities for managing mental health in patients with psoriatic disease. And in that, we talked about, the psoriatic march and how patients not just have skin, but they have systemic inflammation. Much of the work has been in looking at cardiovascular comorbidities, but we also need to be more aware about neuroinflammation and also some of the consequences that patients have with having uncontrolled psoriasis in terms of things like the burden of disease, smoking and unhealthy lifestyle choices that then can exacerbate their mental health disease. We talked about cumulative life course impairment and how we might employ strategies. And we were also talking about screening questionnaires to identify depression and suicidality for patients who were in our clinics, but also how it could be a challenge and clinicians don't have a lot of time to see patients and they're fearful of opening Pandora's box and then not knowing where to signpost or how to help that patient if they disclose that they have severe mental health impairment from their psoriasis, or indeed suicidal ideation that we see in about 10% of patients with psoriasis. So for that reason, we talked about some other opportunities, but also how we as the dermatologist, and we can give them hope with the advanced therapies that we have available to them, and how we need to move patients through the therapeutic armamentarium to have tight disease control. We also covered some of the other things that could be helpful, such as mindfulness and CBT as well, and talked about some of the therapeutic strategies in terms of SSRIs and other medical therapies that can help patients with depression as well, and how it really is part of our role as a dermatologist to give holistic management to patients with psoriasis.